and welcome to the Axiom Medical COVID-19 Vaccine Facts versus Fiction live stream that we're hosting today. Just a quick background. My name is Holly Foxworth, and I am one of the registered nurses. I'm also the marketing manager for content here at Axiom in case you've stumbled upon our feed or you're new and you're not familiar with who we are. But as always, I do have a brilliant team, the best minds in medicine and communication, both that are going to be joining our panel today. We have Dr. Scott Cherry, who's our Chief Medical Officer. We also have Dr. Peter Matos. We have Chief Marketing Officer, Derek Wheeler, and then also Communications Director, Autumn Brennan. So they're going to walk us through some of those most recent myths that have been floating around, whether that be on TV, on social, etc. All right, Dr. Matos, we're going to come back to you. I think this one, we're going to go to the one about the controversial substances. This one's definitely raised some eyebrows. Is there any truth to vaccines containing controversial substances, and are you aware of where this may have came from or what they may be relating to?
Yeah, so I think there's some misunderstanding, specifically the Johnson & Johnson vaccine. There was some information that came out from various contradicting information from different Catholic archdioceses initially, and then also some other, there was a religious, basically objection to J&J. The misinformation was that there were fetal components, cells used to make the J&J vaccine. That is false. What is true is, remember, I go back to that beginning, 90%, factual, 10% spin. There's something called, there are 293 cells. They were from, we don't know, some type of either, we don't know whether it was an aborted fetus or it was a miscarriage. There were fetal cells from 1972 in, I believe it was Denmark or the Netherlands, that they immortalized, and these cell lines are propagated again and again. You can actually order these cell lines from what's called ATCC, American Type Culture, and then there's a European equivalent. But it was one time thing that they took that tissue and they kept propagating the same tissue from 1972. So what these cells are used for a lot of times actually are to test a vaccine, to test how well the vaccine works in our system. And that's been standard. When I did research, I think I was doing research on an adenoviral vaccine, going back 25 years before I went to medical school. And we use these cells to kind of test the expression of the vaccine. Does it work? So yes, there were immortalized fetal tissue cells from 1972 that were used in J&J to verify that the vaccine worked. That is true. So some people might say, I'm comfortable with that, but if you have a religious objection, I would say, talk about that with, your priest, your rabbi, your mullah, whoever, and, decide if you're comfortable doing that. And if not, what I've advised folks, then, get the mRNA vaccines, right? They were done in a different way and they did not use those cells. So I think that's where some of the confusion came in, specifically with J&J and the fetal components.